hope I'm audible and visible. Please give me a quick thumbs up if my audio video is fine, all my dear students. Please give me a quick thumbs up if my audio video is fine. And let me see if my videos and audios, they are working or not. Please give me a quick thumbs up if you all can see me clearly. And if there's no issue with my audio video. Amazing. So welcome on the next session of Let's Crack NEET PG with me, Dr. Chesta Agarwal, your dermatology educator. You are on the best online platform for the preparation of NEET PG, and that is Unacademy. Now download the Unacademy learning app from the App Store and choose a category that is NEET PG. Choose a category that is NEET PG. Now once you choose a category NEET PG, you will get two options. One is the free classes, which are known as special classes. Free classes which are known as special classes. And we have paid classes which are of two types, plus and iconic, which are of two types, and they are plus and iconic. Now special class are the live classes which occurs every day on the Unacademy platform. These are the live interactive sessions which includes a lot of important point discussions similar to that of a plus class. That is the poll options. You will never miss a class. You can have the lectures anytime, anywhere you want. So all these features are with the special class. I do take a lot of special class on the platform. The usual timings are 11 AM, and I request everyone to please get yourself enrolled using the referral code Chesta10. Now we also have personal guidance as well as we have the two type of paid subscriptions. One is plus and iconic. Plus give you an access to Unacademy, while iconic give you an access to both Unacademy and Prep Ladder. Both these two platforms are amazing platform for your preparation. In addition, the combo pack also give you an access to the personal guidance, study planner, study material, expert guidelines and test analysis. Now we have a highly updated question bank of around 25,000 plus questions, and I request all of you to please be a part of it. Now we are proud to have many learners with us who have achieved amazing ranks in their exams. The batches which are about to start are the FMG batch starting on today, that is 8th, 2021, and another batch is the target next batch again starting today on 8th. The NEET PG 1 month package still going on, so I request all of you to please be a part of these classes. One grand test which are left is on 9th September, that is tomorrow. We have amazingly introduced the two platforms of 24 month plus 4 month. That if you get a 2-year subscriptions, you will have 4 month free, and in addition you have 10% discount. Similar to that, if you take a 12-month subscription, 2 month is free, and you will have an additional 10% discount if you use the referral code Chesta. So this is a few of the important notices which I wanted to make, and this is the price list. Longer the subscription, lesser will be the per month cost. So I want you to take longer subscriptions more. And you can use my referral code, that is Chesta10, to get additional 10% discount. We also have a bug bounty program, and I want all my dear students to please be a part of it. Okay. Now starting with the first question. Please tell me the answer of this question. I hope you all can see it. It is visible. Please give me a quick thumbs up. A coagulation profile in a 13-year-old girl with menorrhagia and following cutaneous lesions having von Willebrand disease. What is the answer? Now, what is the dermatological question here? You can see that there is present of pinpoint or palpable purpura. Please remember what is purpura. When the red blood cells comes out of, or there is extravasation of red blood cells out of the blood vessels, they start getting themselves deposit inside the skin, giving rise to erythema which is non-blanchable. For example, if there is erythema because of redness, like for example because of vasodilatation also you will see redness or erythema, and because of deposition of RBCs also you will see erythema. How to differentiate between both of them? Please remember, when you press those lesions with a glass light, If there is complete blanching, it means you are dealing with vasodilatation related erythema. But if there is non-blanchable erythema, it means you are dealing with either purpura, petechiae or ecchymosis. Now the question is, what is the correct answer? The von Willebrand profile in a 13-year-old girl with menorrhagia and following cutaneous lesions having von Willebrand disease. So for this you need to know what are the intrinsic and the extrinsic pathway. Intrinsic pathway, it includes the factor 12 which becomes activated to 12A. This 12A then activates 11, it then activates 9 and then it activates factor 8. Now please remember, factor 8 is bound to von Willebrand factor which is required for its stability. So when you have problem in the von Willebrand factor, the factor 8 will not get activated and the intrinsic pathway will not work. And when the intrinsic pathway will not work, you will have increased in the APTT. So that is a simple question. The only dermatological aspect which we want to discuss here is the palpable purpura. So please remember, you will have prolonged PTT with normal PT here. So the correct answer is this one. Clear all of you? Coming to the next question. Another very interesting question from the same topic. This is some of the integrated questions which you can expect. Anusha, Shweta, Surendra, these are some of the integrated questions which you will expect in your upcoming exams. So I request all of you to solve. 13-year-old boy presented to emergency department with a deep skin abrasion on his knee. He states that it has not stopped since it happened. So a child had, or a 13-year-old boy has an injury during the recess. Until the time of injury, the bleeding have not stopped. So what does it mean that there is prolonged bleeding time? Okay, the bleeding time is prolonged. You can see multiple purpura, petechiae on legs, arms and also on chest and gums. Her bleeding time is prolonged. Very well done. Platelet count is 3 lakh and hemoglobin is 11 grams per deciliter. Now if bleeding time is prolonged, the platelet count is normal, then what does it tell you? It tells you that the problem is in platelet function. But when you give a trial of cryoprecipitate, the BT does not improve. But platelet transfusion causes the improvement. So it's a clear-cut case of Bernard-Solier disease where you have abnormal platelet function. And what is the problem? The adhesion of the platelet to the blood vessel wall is defective, giving rise to prolonged bleeding. Is that clear, Surendra, Shweta, Anusha? Very interesting question. You have a lot of point given. When you have prolonged bleeding time, it can be because of either the platelet issues or because of the clotting factors. But clotting factors will get improved when you give cryoprecipitate. But here the improvement occurs only when you give platelet transfusion. The platelet number was normal, so the problem is that there is defective platelet adhesion to the blood vessel wall, and that is a characteristic feature of Bernard-Solier. And can you tell me what is that receptor? What is that receptor which is involved in a patient of Bernard-Solier? Anybody? Shweta, Anusha, it is GP2A3. Okay, GP2B3A is the receptor which is involved in the attachment of the platelet to the blood vessel wall. Coming to the next question. Now here they have given you a very classical nail finding. Can you tell me what is this nail finding? Anyone can tell me? Shweta, Anusha, Surendra. Can you tell me what is this nail finding? Yes, this is a case of koilonychia. And what is koilonychia? It is a feature of iron deficiency. Koilonychia, it is a feature of iron deficiency anemia. Koilonychia is a feature of iron deficiency anemia. Now let's read the question. A 28-year-old woman come to the OPD with fatigue and characteristic nail changes. Lately, she has been having difficulty making through the day without taking a nap. So she feels very fatigued, lethargic. The energy levels are down. She is usually healthy with no medication. The only complaint which she gives is increased tiredness. Her menstruation was of 3 weeks and was very heavy, so bleeding is heavy. You can see that there are decreased iron and the iron stores with increased iron binding capacity. So all these points that you are dealing with a case of iron deficiency anemia. So the blood is also favoring the iron deficiency anemia, which is hypochromic microcytic anemia. She was given iron tablet. Now can you tell me, if you start a patient on iron tablet, how many what is the duration of the, or what is the life cycle of a red blood cell? For these microcytic hypochromic erythrocytes, you take around 90 to 120 days, which is the life cycle of red blood cells. Now the question is, if you do a repeat peripheral blood after 1 month, what will you see? All large erythrocyte? No. Why will you see large erythrocytes? No. All normal? No, because this hypochromic microcytic erythrocyte will die over a period of 100 to 120 days. But we are having a repeat peripheral blood smear in 30 days only. So obviously you will see, along with the normal, you will see these small erythrocytes. So please remember, the correct answer becomes the mix of small and normal erythrocytes. Okay, clear? Anusha, Monica, what is the concept here? Because of the oral intake of iron, you will see development of normal erythrocyte, but the existing microcytic hypochromic erythrocytes will remain in the body, and they will take at least 3 months to wash out or to die. And that is why if you repeat a peripheral blood smear after 1 month, you will see a mixture of both small and normal erythrocytes. If this is clear, please give me a quick thumbs up, all of you, if this question is clear. Anusha, Monica, Shweta, all my dear. Okay, ji, fine. Coming to the I'm very sorry for this. Coming to the next question. Very nice. So what about this question? Fine. So which of the following is not a clinical feature of kwashiorkor? I don't know why everybody is writing bilateral pedal edema. You do see bilateral pedal edema, but muscle wasting is not a feature of kwashiorkor. You do see, but it is very frequent with marasmus. So what is the feature of kwashiorkor? You have essential and non-essential features. Essential features means the weight for age of that child is at 60 to 80%. You will have mental changes and you will have edema. And the non-essential factors includes the hair sign, that is, you see alternate dark and light band. This is known as the hair sign. You have alternate dark and light, and then you have something known as flaky paint appearance. You have flaky paint appearance, a characteristic dermatological feature of kwashiorkor. Okay, ji? So this is how the kwashiorkor baby looks, little fat because of the hypoalbuminemia. The blood will come out, or the water will come out of the blood vessels, causing edema all over the body. You will have moon faces, pot bellies, bilateral pedal edemas, anorexia patient, and along with that you will see the features of skin changes in the form of flaky change and hair. While in marasmus, the baby will look very, very cachexic. You will have severe wasting. So muscle wasting indicates more towards marasmus. They will give you a old man appearance. The child will be irritable, but as soon as you keep the food in front of the babies, they will eat it. So you have voracious appetite here, which is very, very important. So which of the following is not a clinical feature of kwashiorkor? The correct answer becomes option number 2, that is muscle wasting. Now can you tell me the answer here? The kwashiorkor is diagnosed with the growth retarded children along with. Kwashiorkor is diagnosed in growth retarded children along with. So just now we have read that there are three essential criteria. One is the growth of 60 to 80% of the expected body weight. Another feature is you have presence of edema and mental retardation. So the correct answer becomes option number 1. Edema, mental retardation and the growth retardation, they all three become the essential criteria. We have discussed this point here. So remember, you will get a lot of questions from nutritional deficiency in your medicine, pediatrics as well as in your dermatology. So at least remember them. All are the features suggestive of marasmus except. All are the features suggestive of marasmus except. Mistakes which you do not have to make for this particular question. The all features are suggestive of marasmus. Little old man appearance, very nice. Little old man's appearance, very nice. This is correct. Child is irritable, that is again correct. And the body weight is less than 60%, that is also correct. But what about the diet? Please remember, you have voracious appetite. You have voracious appetite. It means that as soon as you put the food in front of the child, he will eat as if he has never seen the food before. So that is known as voracious appetite. But in Kwashiorkor, even if you keep the favorite food of that child, he will not eat, and that is the reason because of presence of anorexia. So please remember, anorexia is a feature of Kwashiorkor, not marasmus. Very nice, Monica, Arumili, Shweta, Anusha, everybody is right for this. All are the features suggestive of marasmus except, and the correct answer becomes anorexia. So hello Dr. Kaustubh, I hope everybody's preparations going well. So it's been a long time I've seen you in the classes. Dermatitis may be clinical manifestation of deficiencies of all the following nutrient except. Amazing, amazing. So please remember, the correct answer here is thiamine. What is thiamine? It is vitamin B1. Is it clear or not? What is thiamine? Thiamine is vitamin B1. In vitamin B1, what do you see? You see dry berry. You see dry berry or wet berry. Dry berry or wet berry. Or you see Wernicke's or Korsakoff psychosis. Wernicke's or Korsakoff psychosis. So please remember, the cutaneous manifestation is not that frequent in vitamin B1 deficiency. While pyridoxine, you will see dermatitic lesions. Specifically, you will see angular cheilitis. You will see presence of photodermatitis and niacin, and even biotin deficiency will give you dermatitic features. Only thiamine, which will give rise to beriberi, the wet beriberi will give the features of heart failure, while dry beriberi will give you the features of the psychosis, Wernicke's or Korsakoff. Okay, clear? So amazing, Monica, Shweta, Kanya, Arumali. Another question we have on our screen, and I hope the image is visible. Let me shift it a little more towards the visible area. Very nice. Two-year-old boy was referred to derma OPD with intractable pruritus, scaling, dry skin and generalized eczematous lesions. resistant to atopic dermatitis therapy. Parents report that he got treatment for desquamative skin lesions. No family history of skin disorder, but when you examine the skin, you can see here in the image that you can see the presence of double-edged scales on the background of erythema. You can also see a characteristic hair shaft disorder. What can be the diagnosis here? What can be the diagnosis here? What can be the diagnosis here? Trichothiodystrophy, Netherton syndrome, lamellar ichthyosis, or atopic dermatitis. What is the answer? Very well done. Please remember, it's a very important question actually. So 2-year-old boy was referred to dermatology OPD with intractable pruritus. Now I want all of you to please concentrate on this image. I don't know whether it is visible or not, but if you look at these scales have two margins or two edges. It means that they are open from two edges. It is adhere to the skin surface from the center. Now this type of double-edged scale is very classical of ichthyosis in Netherton, which is also known as ichthyosis linearis circumscripta. Ichthyosis linearis circumscripta. And what is this hair change? What is this hair change? This is known as trichorexis invaginata. Because if you see that one part of the hair is getting invaginated, so this one part of the hair is getting invaginated into the another part of the hair. The one part of the hair is getting invaginated into the another part, and this is known as trichorexis invaginata. Along with erythroderma, atopic dermatitis, all these becomes the feature of Netherton syndrome. So Monica, you are right. The correct answer is option number 2, Netherton syndrome. Shweta, please remember the answer is not 1. Now I request all my dear students that if you are finding difficulties in dermatology particularly or any other subject, I request all of you to join Unacademy, because specifically before 11th of September, because we are giving the printed notes of all the subjects. They are specifically curated by us. So all the educators will or have made these notes themselves, and this will be available for free if you take plus subscription before 11th of September. So if anybody is targeting the next year exam, my humble request, do not miss this opportunity. If you have the printed notes, it becomes very easy for you to see or watch the live classes. So please go ahead and buy the subscription today itself. Use my code Chesta10. Now after that, you will only get the printed notes in Iconic subscription. Iconic subscription is little costlier. For example, for 1 year it is 40,500, but plus for 1 year is 27,500. So it is almost 1.5 times more than the plus. Okay, so I would recommend you to take a plus subscription of 12 month. You will get 2 months free, plus you will get printed notes, plus you will get 10% additional discount by using this code, which is way too cheaper. Trust me, I'm not saying this because I'm part of Unacademy, but if you compare it with any other offline coaching centers, they are charging much higher for the same package, and they have no opportunity of repeat classes, nothing like that. So please take the benefit of this Unacademy notes. Okay ji, fine, clear. And we are done with this question also. The answer here is Netherton syndrome. Let's go back to the next question. So this is how I was telling you what is double-edged scale. I think this image is a very classical image. This is how ichthyosis linearis circumscripta look like. You have two margins of these scales. The two layers of the scales are going across here in this particular picture. Okay, clear all of you? Please give me a thumbs up if this point is clear. Chalo ji. This is called as the trichorexis invaginata. Bamboo hair or ball and socket deformity is also another name. ठीक है जी. Coming to the next question. Three-month-old Muslim male infant coming from a lower socioeconomic class, born out of consanguineous marriage, full-term uncomplicated delivery, was admitted to the pediatric ward with a history of recurrent convulsion, which was the tonic-clonic in nature. He has repeated attacks of coryza, convulsions, pneumonia, etc. And he was the only child in the family. There was no significant family history, and the patient was exclusively breastfed till now. No significant antenatal history or drug history during pregnancy. What is the possible diagnosis? Ectodermal dysplasias, Minky disease, Wilson's disease, or phenylketonuria. What is the correct answer here? Ectodermal dysplasias, Minky disease, Wilson's disease, phenylketonuria. Anyone can tell me the answer here? A 39-year-old Muslim male coming from a lower socioeconomic class, born out of consanguineous marriage, full-term uncomplicated delivery, was delivered or admitted to the pediatric ward with history of recurrent conversion. What is the correct answer? Amazing, all of you. Here the case is of Minky Kinky disease. It's a classical example of Minky Kinky disease where you have copper metabolism defect. You have abnormal copper metabolism or absorption. So when copper does not get absorbed, there will be decreased copper content in the brain, giving rise to the features like low mental status. Decrease in skin and hair will also give you a lot of features. Then decrease in the bone will also give you a lot of features. Decrease in, and these copper, instead of getting absorbed, it will go inside the kidney, causing the effects on the kidney as well. So this is known as the Minky Kinky disease, and this is a classical case of ATP7A. The gene which is defective is ATP7A. Okay? So ATP7A gene is defective in Minky Kinky, while ATP7B is defective in Wilson's disease. And in both of them you have copper metabolism which is getting defective. Okay? And the hair findings are very characteristic of the dry, lusterless, kinked hair. Okay, so you can see it here. You have dry, lusterless, kinked hair present in a patient of Minky Kinky disease. Coming to the another question, let me just shift this image on the left for everybody to understand. Very interesting question. 59-year-old Turkish man who presented with fatigue, loss of energy, dark colored urine. What is the answer for this one? 59-year-old Turkish man presented with fatigue, loss of energy, dark colored urine. When asked, he declares that hyperpigmentation occurred in his hand and face after exposure to sun since last year, and sometimes these skins, these lesions becomes blistered. They leave a scar, and he used to consume an alcohol socially, but since last year he started taking the alcohol on the daily basis. What is the correct answer? Very nice. This is a classical case of porphyria cutanea tarda. What happens in porphyria cutanea tarda? You have defective heme synthesis pathway. Now, how it becomes defective? What happens in porphyria? There is an enzyme which is defective, and that is known as uroporphyrinogen decarboxylase. Uroporphyrinogen decarboxylase. This is a very sensitive enzyme. Now, what happens? Sensitive enzyme. What happens, like when a patient consumes alcohol or take any drug which affects liver, okay, anything which affects liver, what does it do? It goes and it generates inhibitors. So anything which causes generation of inhibitors will cause inhibition of urode enzyme. And when there is inhibition of urode enzyme, the heme synthesis pathway becomes defective, giving rise to accumulations of porphyrin, and these porphyrins will start accumulating themselves into the skin, causing blistering, redness, burning, etc. Okay, so that is a feature of porphyria. Okay, heme synthesis pathway becomes defective. Heme synthesis pathway becomes defective. I hope this point is clear to all my dear students. Very, very important for your exam. Heme synthesis pathway becomes defective. Now coming to another point. What are those factors? They are alcohol, then there are some drugs, you have the hemochromatosis which affects the liver, or whenever you have iron overload, because iron also generate a lot of inhibitors which cause inhibition of uroporphyrinogen decarboxylase, and whenever this thing happens it becomes very important for you all to understand. Okay ji, so please remember porphyria cutanea tarda is the answer for this particular question. Okay ji, coming to the another one. 44-year-old female presenting with hyperpigmentation, rash all over her body along with a V-shaped rash on the neckline since 2 months. Initial symptoms as mentioned by the patient includes itchy rash, photosensitivity, no history of headache, fever, weight loss. She had progressed symptoms like muscle pain, unable to walk, inability to stretch hand. Please tell me a thumbs up, give me a thumbs up if you understood this question. Again, a very, very interesting one. Now, the question says that this female is having difficulty in climbing upstairs, inability to stretch the hands, and unable to turn the neck. All these features are telling you that you are dealing with a patient with proximal muscle weakness. How many of you agree with me? This is a classical feature of proximal muscle weakness. Classical feature of proximal muscle weakness. Along with that of a rash which is present on the V shape of the neckline, it is also present over the other body parts, tells you that you are dealing with a patient of muscle feature and skin feature, and both these together myositis. You are dealing with a patient of dermatomyositis. Clear, all of you? Very easy and a simple question. The V-shaped rash could be a shawl sign. It could be a, if it is around the face or eyes, it could be heliotrope rash. It could be Gotron's papules and plaque on the, knuckles. It could be ragged cuticles, dilated capillary blood vessels. All these features will tell you that you are dealing with a feature or a patient of dermatomyositis. Now, in dermatomyositis, you can see associated underlying malignancies, and that is why difficulty in swallowing food is one of the features which you find in these particular individuals. Coming to the next question, 40-year-old female was referred to oral maxillary radiology department, and on examination we could see that the patient was not able to open her hand. They has a narrow nose because of atrophy of Eller nasi, and you can see decreased number of wrinkles. Upper lip was insufficient to cover the maxillary teeth, and she gave a history of sudden pain in the hand on exposure to the cold. So what could be the diagnosis here? Very easy question, I guess. She gives a history of sudden pain in the hand on exposure to cold. What could be the diagnosis? Very nice, all of you. Very well done. Now you can see that there is tightening of skin which is given. See, if you have wrinkles, it tells. I hope I'm audible and visible to all of you. Please give me a quick thumbs up. I hope I'm audible and visible to you. I think the video got stuck and I was not aware about that point. Like I was clueless that the video got stuck. But chalo, I think now everything is fine. Arumali, Manish, and the answer of the previous question. The answer of the previous question was systemic sclerosis. Answer of this question is systemic sclerosis. ठीक है जी? चलो. We have another question on the screen. A 12-month-old girl with juvenile absence seizures was started on lamotrigine. After a good initial response, 6 months later, she had a few prolonged absences followed by generalized tonic-clonic seizure. Her generalized tonic-clonic seizures improved on increasing the dose of lamotrigine, but absences continued and hence ethoxamide was added. 6 months after adding ethoxamide, she developed severe facial swelling along with the malar rash. She was investigated and referred to a dermatologist. Her anti-nuclear antibody and the double-stranded DNA were positive and the complement levels were low. She was otherwise well with normal examination, the blood pressure and the renal function test. Which other antibody should be done for this particular patient? Anyone can answer this question? Very simple question actually, Anusha, Manish, Arumali. 12-month-old girl with juvenile absence seizure. So here they are telling you that we are dealing with a case of SLE. But this SLE is not a simple one. This is a drug-induced SLE. This is a patient of drug-induced LE. And for drug-induced LE, which drug will you give? You will give antihistone antibodies. So for all my dear students, I am making a table and I request all of you to please make it along with me. Very important for your day after tomorrow's exam. Please do make this table along with me. ठीक है जी? So please do make the table along with me. So what are the antibodies? Autoantibodies in a patient of lupus erythematosus. And what are their significance? dsDNA is considered to be a specific antibody and it will tell you, or it is a marker of disease activity. Marker of disease activity. I want all of you to write it down along with me. Coming to the second one, that is anti-Smith. Coming to the second one, that is anti-Smith antibody. Coming to the second one, that is anti-Smith antibody, it is the most specific. So if they ask you which is the most specific and you have both the options dsDNA and anti-Smith, please do mark anti-Smith as the best possible answer. Okay, so double stranded DNA and anti-Smith antibodies both are important. Okay, double stranded DNA and anti-Smith antibodies, both of them are important. Coming to the next one, that is anti-Rho antibody. What is anti-Rho antibody? It is the antibody for neonatal LE. It is also very specific to SCLE, subcutaneous lupus erythematosus, and it tells you about the photosensitivity risk of photosensitivity. Similar to anti-Rho, we have anti-La, which is also known as SSB. What is anti-La? It is seen in neonatal LE. Then we have anti-histone antibody. And what is anti-histone antibody? It is a drug-induced LE. Anti-histone antibody is a drug-induced LE. Coming to the next part. Okay. What is the next? Is anti-ribosomal P. Anti-ribosomal P will tells you that you are dealing with CNS psychosis. Anti-ribosomal P means you are dealing with a patient of CNS psychosis. Clear all of you? So double stranded DNA, anti-Smith antibody, anti-Rho, anti-La, anti-histone and anti-ribosomal P. So these are the correct options. Okay, and I want all my dear students to please write it down. Srinivas, Manish, Arumali, Anusha, please write it down. This is very important for your exam. Let's move to the next question. Very interesting question with the image. So please write it down or answer it. Very important question. Please tell me the answer of this question. Two-week-old Iraqi male newborn was brought to the pediatrician unit of a new onset of multiple cutaneous erythematous annular lesion over the face scalp for the past 1 week. The lesions were progressively increased in size and there were no history of fever and the baby was feeding well. The mother had one spontaneous abortion in the past. What could be the diagnosis? So anybody here can tell me what could be the correct answer for this particular question? Very nice. Now here you can see that a child or a newborn or a 2-week-old patient has lesions around the eyes with a history of mother having a spontaneous abortion. So this becomes a very important diagnosis, that is neonatal LE. Neonatal LE occurs because of transplacental transfer of the antibodies like anti-Rho and anti-La. Now what happens? These antibodies will cause 2 or more features. One of them is the cutaneous features, which heals spontaneously after 1 to 2 months. You can also get congenital heart blocks which are permanent. Okay, so these are the features of neonatal LE, and because of classical location around the eyes, they are sometimes called as panda's eyes or raccoon's eyes. Okay, so these are some of the terminology used for this particular condition. Coming to the next question. A 53-year-old lady presents to medical assessment unit with a flu-like illness and myalgia. In the last few days, she had noticed a rash across her back. She has no other symptoms. On examination, she looks unwell. There is an erythematous rash across her back and she has a grade 4-5 weakness proximally. Her CK, which is elevated at 1052, and her renal function test is normal. What is the correct diagnosis? I think it's a straightforward question of dermatomyositis. There is no confusion here. Anyone has any confusion with this question? A straightforward question, and that is why we don't have to think, because the elevation of the muscle enzymes with the cutaneous features, the muscle weakness, specifically proximal, all together gives you an idea of dermatomyositis. So with this, we are done with the today's session. Thank you all of you for your patience listening. I request everyone to please follow all my classes on Unacademy. You can subscribe to this YouTube channel. The name is Let's Crack NEET PG, which is a free channel for your NEET PG preparation. You can also follow us on the Telegram group. The name is again same, the Let's Crack NEET PG. If you want Unacademy subscription, use the code Chesta10 to get 10% additional discount. Another is, you can also press the bell icon to get the notification of my class, and please give thumbs up to all my classes if you like them. Okay? Lastly, I just want all of you to be aware about the same thing which we have discussed in the beginning, that the Unacademy gives you the opportunity to get the Unacademy notes for free if you buy an Unacademy Plus subscription of 12 months before 11th of September. If you use the code Chesta10, you will get 10% additional discount. You will get 2 months free, and you will get the printed notes. So it's like win-win feature available for all of you. I request everyone, only 3 or 4 days are left. So please go ahead and get an Unacademy subscription for 1 year, specifically those who are targeting the next year entrance examination. So thank you all of you. Take care. And